Hi, I'm Dr. Mickey Bui.
And I'm Dr. Norman Johansson, and we are the Shore Physicians Group Joint Replacement Team.
We have prepared this video to walk you through the process now that you've decided on joint replacement surgery. Prior to surgery, we're going to connect you with a surgical scheduler who will become your point person and who will guide you through the process leading up to surgery.
You will be asked to see your primary care provider and your cardiologist if you have one for medical clearance. If you have any other major conditions, we will ask you to see those specialists as well, just to make sure that you are optimized and in the best shape possible for surgery. This is a big part of minimizing complications after surgery. We will also be having you get a standard set of labs and tests, as well as a COVID test.
Depending on your overall health, we will decide whether you're safe for outpatient joint replacement. That's when you go home the same day, or if it's actually safer to keep you overnight for observation.
If you have outpatient surgery, we will make sure you have all necessary equipment prior to the day of surgery, such as a walker and commode. And post-surgery, you will walk with a physical therapist in the recovery unit prior to discharge.
If you stay at Shore Medical Center overnight, you'll be in a specialized orthopedic and spine unit, where most rooms are private. You'll also work with our hospital physical therapist, and they'll decide if you're safe to go home after 1 or 2 nights, or if it'll be safer for you to go to a rehab facility.
Most patients recover in 6 to 12 weeks, but you are walking from day 1. During this time, you will be steadily getting stronger and your pain is improving day by day.
You can shower with your dressing, and you're to leave it in place for 1 week after surgery. The new dressing will be given to you to put on for the second week. The goal is to get you back home as soon as possible, but only when it is safe to do so.
The first few weeks, a physical therapist will come to your home, and once you are getting around well, you will move on to outpatient physical therapy. You will see us at 2 weeks from surgery for a wound check and suture or staple removal. Then again at 6 weeks and 3 months for checkups. These visits are included at no additional cost.
We at Shore Physicians Group and Shore Medical Center have systems in place to maximize your results and providers who will take their time with you and see the process through to completion.
Thank you for watching this video. We look forward to providing you the highest quality and safest care before, during, and after your joint replacement surgery.